Hi everyone, welcome to another episode of Just-in-Time Education, a podcast for healthcare HR. Thank you for joining us today. My name is Megan Doherty and I'm the Educational Content Specialist at Healthcare Source. It's my pleasure to welcome David Zari, founder of Lean Human Capital and the Recruiter Academy, and Rebecca McNeil, Senior Education Manager at Healthcare Source. As some of you may know, on July 1st, we launched the third annual HR Initiative Survey. The purpose of the survey is to learn what the top HR initiatives are for 2013 and 2014. So I'm going to talk to two of our webinar panelists today to get some of their predictions. So first off, David, last year a majority of people said that they were going to streamline their HR processes and reduce retention in an attempt to reduce costs. Do you have any predictions as to what the biggest trends in healthcare talent management will be for this year?
You know, I do, and one that jumps out is sourcing candidates for critical to fill positions. We did actually a survey earlier this year of talent management thought leaders throughout the country, and we asked them a question. So what are your top initiatives in talent acquisition? And the number one response was sourcing for critical to fill positions. And quite honestly, it makes sense based on some of the benchmark data results that we have in our study. Vacancy rates were up year over year for the 172 hospitals that were in our study this year. And the average time, get this, the average time to fill for positions filled in over 60 days was 123 days. And that was 23% of a typical hospital's positions. So 1 in 4 positions took 123 days to fill. And those positions are critical to patient safety, patient satisfaction, and costs. So I'd say that's definitely a big prediction on our end.
Great, thank you, David. So Rebecca, since 2011, an increasing number of survey respondents have said that they were preparing for healthcare reform and also in an attempt to reduce costs. Why do you think this is happening?
Well, Megan, that's a great question, and I know that Stephanie Drake, who is the Senior Executive Director of Professional Services for the American Hospital Association, is going to speak more about this during the live webinar. But in my opinion, you know, I've seen that the CMS, which is the Center for Medicare and Medicaid Services, which is in charge of initiating a lot of these healthcare reform programs, tends to roll out new initiatives in a testing phase first, and you know they did that, for example, back in 2008 with the HCAP survey. But now, you know, more and more hospitals are participating in these initiatives. And in 2013, 2014, you know, we're not in a testing phase anymore. Things like value-based purchasing, which impacts reimbursements from the CMS, are taking place on a much larger scale. So even 1 or 2 years ago, hospitals had, you know, committees for service excellence and certainly executives who were really on top of these healthcare reform issues and concerned about them. But I think now everyone's in the game. Everyone's more involved, including HR. So I think that's why we've started to see this uptick in response to healthcare reform.
Great. Thanks, Rebecca. I'm looking forward to hearing from Stephanie during the live webinar. So David, why do you think HR and talent acquisition professionals should attend the HR Initiatives webinar on September 4th? What is the benefit of attending?
Well, I tell you, every year I think your study provides great insights in understanding the key trends in the industry. I mean, we're thinking about these initiatives, and it also can validate your assumptions about what you think are top initiatives. You're able to really kind of reconcile that against what other thought leaders are thinking about around the industry. But I think probably most importantly is learning from practitioners like Dr. Morgenstern. I mean, you know, whenever he speaks, I always seem to walk away pulling great insights or thoughts. He has such great pragmatic information. He puts it in a layman's style. So I think the people that you have on the panel, you always will learn from. So it's a great webinar and a great study that you put together, and I'm looking forward to it.
Great, thanks, David. We are too. So everyone, the results are in. Register for the Healthcare Source and ASHRA HR Initiative Survey webinar taking place on September 4th at 1 p.m. Eastern to learn what your peers think are the biggest trends in healthcare talent management this year. Thank you.